So, good afternoon, and thank you so much for joining us for this UWS Chiropractic Workshop Week. My name is Natasha French, and I'm the Assistant Director of Admissions and International Student Advisor here at the University of Western States. Our event today will include a presentation about sports medicine and chiropractic by Dr. Bill Moreau. Afterwards, we'll save about 10 to 15 minutes for Q&A to answer any questions that may come up during the presentation. The entire event will be recorded, and we'll share the recording with everyone who RSVP'd, so don't worry if you need to log out. Our presenter today, again, is Dr. Bill Moreau, the Chief Medical Officer here at UWS. Dr. Moreau is a distinguished chiropractic physician and world-renowned sports medicine expert. As the leader of medical services for the U.S. Olympic Committee, Dr. Bill Moreau worked with Olympic and Paralympic teams where he was responsible for the care of thousands of Team USA athletes, provided by more than 200 clinicians from numerous healthcare disciplines. During his tenure at USOC, Dr. Moreau served as the Team USA Chief Medical Officer during the Rio 2016 Summer Olympic Games and the Pyeongchang 2018 Winter Olympic Games, as well as serving as the medical director for the London 2012 Summer Games and the Sochi 2014 Winter Olympic Games. Needless to say, over his more than 30-year career, he's also treated collegiate, high school, and recreational athletes. Dr. Moreau is a licensed chiropractic physician and a board-certified diplomate in the American Chiropractic Board of Sports Physicians. He has presented more than 500 lectures and postgraduate education programs throughout the world. Dr. Moreau is currently president of the ACBSP and is a member of the Journal of Chiropractic Medicine Editorial Review Board. Without further ado, please join me in welcoming Dr. Bill Moreau.
Well, hey, thank you very much for that kind introduction. I really do appreciate that. And I'd like to welcome all the attendees to our talk today. My understanding is that you're either enrolled to come to the University of Western States or you're interested in the field of chiropractic. My topic today is to talk about how does chiropractic weave into the world of sport. My background is I really practiced in Midwest United States for almost 30 years and then became certified in sports chiropractic. There's two different certificates of additional qualifications. The highest level is the diplomate of the American Chiropractic Board of Sports Physicians. That's what I have. And then the lower level one that I had before I got the diplomate is a certified chiropractic sports physician. Those are competency-based certifications. In addition to that, at the University of Western States, you can also obtain an academic-based certification in sports medicine, not really a certification, but a master's degree in sports medicine. So if you're interested in sport and you're interested in humans and health, this is the place to be. So I'd like to share with you a little bit about what I did at the United States Olympic Committee and some of the interesting things, at least interesting to me, about the world of chiropractic and sports chiropractic. Let's go ahead and I'm going to share a screen so that we can look at a little slide deck that I've got for you today. And here it is. So hopefully you can see this slide deck. And I'm just going to assume you can. Natasha, if you could just give me an audio yes or no that you can see it.
Yeah, it looks great.
All right. Well, I'm so glad. I really like that slide. The reason I like to start out with this slide is because people oftentimes think about sport and they think about what we call the big four, like American football, basketball, baseball, those types of things like that. But in actuality, there's many different forms of sport. And especially if you happen to be from Canada, you would know about things like curling is a really big sport. And for me, it's one that I really enjoy taking care of those athletes. So not only was the sport that the person participates in very varied, but so is the actual individual who participates in that sport. And what I mean by that is we should see everybody as an athlete. For instance, my mom, she's 96 years old. She walks on a treadmill. She does strength training. She's an athlete to me. And so the athlete doesn't just simply have to be the person on the Wheaties box. And in addition to that, we also should see individuals who don't necessarily look like us as athletes. For instance, people that are differently abled, people that don't have an arm, people that have a spinal cord injury. Everybody could be an athlete because we recognize that movement is important to health. Let's talk a little bit about that. This next slide is basically just a disclaimer slide that says, I'm just representing my opinions and what Dr. Moreau thinks about today. So this is a statue outside of the Colorado Springs Olympic Training Center where it shows three athletes holding the weight of the world. And unfortunately, in sports, sometimes the athletes actually feel like that too. My background is, as we've already said, I was in private practice and I was in a small rural community where a lot of people started coming to me for their sports injuries. That's when I figured out that people are looking for a non-surgical management of sports injuries. That's a cool thing about being a doctor of chiropractic. You have full licensure to evaluate, diagnose, and manage sports injuries. Even if the injury is a surgical injury, like an ACL tear in a young athlete, well, then you get to collaborate with the orthopedic surgeon to help your patient get back into the game. So a little bit about that. When we talk about today, I just wanted to talk about what do sports chiropractors even do anyway? And so we're going to talk about that, and we're going to talk about sports chiropractic at the elite level. Some of you may recognize this slide. This is a slide from Rio de Janeiro. That's Sugarloaf in the background, the huge statue that dominates over the city. And that's where the Rio Olympic Games were. It was an interesting Olympic Games because the United States, it was the first time they ever had a doctor of chiropractic acting as their chief medical officer, and that was me. Only person that's ever been a chief medical officer at an Olympic Games. But what happened there that was really interesting is Team USA outscored the competition in the medal count by a record 51 medals. And I'm not saying that it's because there's a chiropractor running it. That's not what I'm saying. But what had happened is it was the first time in many, many, many years that we actually fielded a healthy team. And the people that were there were able to keep their health. And so when you can beat a nation like China by over 50 medals, it's really a huge undertaking, all to the credit of the team. So if you wonder, like, well, how does that happen? There's lots of big countries out there. Absolutely. But the interesting thing about the United States, and I would also include Canada, by the way, Team USA and Team Canada, we're really good friends when it comes to healthcare, not so much when we would play ice hockey. But nevertheless, the reason that the United States is so successful is one, the size, and two, is that we literally are a melting pot of the world. Regardless of the athlete that you're looking for a particular sport based upon body composition, all those different types of things that help somebody be successful, they live here. And in addition, you can see in this photo that we have some individuals in a wheelchair and we have all different kinds of people. So it takes all different kinds of athletes because there's so many different sports in order to field a highly competitive team. I think that when you think about who inspires you the most, well, I had the privilege of taking care of Michael Phelps, the greatest Olympian of all time. But when you think about who inspires you the most, it's actually the Paralympic athlete. What the human body can do is absolutely amazing. For instance, I had a patient who had what's called proximal femoral focal defect, which means that when she was born, I'm not going to use the word birth defect because I don't consider her defected. She just simply didn't develop like everybody else. And on one side, she didn't have a femur. And so that limb is relatively non-functional. So it's typically removed very early in their life. And so she is a one-legged athlete. She's also a mechanical engineer. She also is a downhill ski racer. And so I don't know about you, but going downhill at 60 miles an hour with both legs is pretty scary, but she does it on one. And then in her off time for fun, she rides her mountain bike in the foothill of the Rockies with one leg. And so, to be honest with you, I didn't even know people could do that. I didn't know that was even a possibility, yet it was. And I met person after person after person that showed me that they may not have every function that I have, but they're able to do actually much more than I do simply because of their motivation. And so when you work on people like that, it's a tremendous privilege to be able to help them. Currently, I have a 101-year-old person that's one of my patients, and we've been able to help her so that now she can walk without a walker. Just because a person's 101, it doesn't mean that they can't still be functional and independent in their living. So sport and chiropractic go together really well, and we'll talk more about that. When you work in the world of sports medicine, the primary mission of the physician is to protect the health of the athlete. So, really, team physicians have three different jobs. Before the event, it's the prevention of injuries. And one of the ways we might do that is through the pre participation examination. During an athletic event, then our job is the triage of injuries, which means to evaluate, make a diagnosis, and then make the correct return to play decision. After the game, that's where you have the treatment, the rehabilitation, and the follow up for whatever it is that you saw. So you could imagine, boy, that makes the most sense of all is whatever we could do to prevent injuries from occurring, that would be a good thing to focus on. And so that's one of the things we work on. When you think about skills, how about a doctor of chiropractic as a team physician? What? Yeah, that works out really, really well, actually, because we have both an understanding of the what I would call the gambit of conservative care, which may mean physical therapy, it may mean acupuncture, it may mean massage therapy, it may mean working with a strength and conditioning coach or a certified athletic trainer. But we also know when a person needs to see the cardiologist, when the person needs to see the orthopedic surgeon, when the person needs to see a pain management specialist, when the person needs to see OB-GYN or whatever it might be. And so that's how come I think that a doctor of chiropractic is pretty uniquely situated to help direct patients to the correct provider to help them get better. At the University of Western States, we have a motto, the patient first. And that's indeed what we live to, is we put the needs of the patient ahead of our needs, ahead of anybody's needs. Because if we focus on what our patient needs, that's when we have that opportunity to make a profound difference in another person's life. That's one of the things I really like about being a doctor of chiropractic is you have the ability to relieve another person's pain and suffering simply by using what you know in your hands. I think there's some honor in that. We all need to have an important mission in life. And I think that that's a pretty good mission. On this slide, you see a beautiful picture from the opening ceremonies. But look at the last line. The last line says, abide by the Olympic Movement Medical Code. You might want to actually look that up if you're into sport. And the reason is that code, it basically says that you're going to put the athlete's best interests ahead of all other considerations. That's harder to do than you think. I can remember working a junior high football game, American football, and the kid was like a ninth grader, and he clearly sustained a concussion. I said, "You're not going back in," pulled him out from the game, and had him under my observation. Well, what happened was his parent, his mother, came down out of the stands and said, Dr. Moreau, you have to put Jared back in. And I said, he's not going back in. He's got a head injury. In fact, I'd welcome you to take him home right now. And she said, if you don't put him back in, we're not going to win this game. And I thought, wow, that's pretty messed up. Your doctor just said your kid has a head injury and she's worried about the ninth grade football team not winning a game. And so the pressures come from many different places in the world of sports medicine. Comes from the athlete, comes from the parents, comes from teammates, comes from coaches, comes from colleagues, might even come from yourself. So it's really important that we all remember to always place the health of the athlete in the first position, always. And so when you look at the team, it's kind of hard to perhaps work an equestrian event if you don't know anything about the sport, cross country, for instance. Um, the athletes are 1,000-pound plus horses. And if you're not used to working with horses, then there's all kinds of different nuances that come with that. And so you have to kind of know the team, know the sport, Then you have to learn about your athletes. For instance, which one's an asthmatic, which one's kind of shy, which one is kind of aggressive, which one has had a prior concussion, all of those things. And you need to know how to be a teammate. And what I mean by that is not a teammate to the athlete, but a teammate to the whole team. In other words, know what you can do, be very, very skilled at what you do, and then make sure that you see who's around you that can also help serve the athlete so that they can receive the best care possible. This is a slide out of the opening ceremonies in Rio de Janeiro. That's Michael Phelps carrying the flag. Um, Kind of an interesting thing is Michael got in trouble because he's supposed to walk about 10 feet in front of everybody else. And he said, well, I'll carry your flag, but I'm not walking ahead of anybody. And so there he is. Kind of interesting. How do we make good decisions about serious injury, and how could we prevent serious injury? Well, there's a little saying that you prevent what is preventable, but you manage to the rest. For example, lightning strike. Lightning strike is one of the uncommon ways that people die. Well, as a doctor of chiropractic, what are you going to do about that? Well, you're going to be prepared for those kind of things. Normally, the officials will clear the field of play when lightning's in the immediate area. So, in other words, it's pretty difficult for you to run out there and stop a lightning strike. But there are things that you actually can prevent. And one of the most common ones is heat injury. So, the people that really get hurt in sport, the most common things that they get hurt from are heart problems, specifically hypertrophic cardiomyopathy and coronary artery anomalies, head injuries, epidural and subdural bleeds typically, and then heat, heat stroke. And so if you understand those types of things present along with sickle cell crisis about 80% of fatalities in high school and collegiate sport, then you can develop emergency action plans around those things. And Dr. Chiropractic can actually help with that. So here's an athlete. This athlete's widely published. You can look this person up on the internet. And so I'm not revealing any secret information. This is Flo Hyman. And so Flo had a cardiac pathology that wasn't picked up in junior high, wasn't picked up in high school, wasn't picked up in college, wasn't picked up for 3 different Olympic Games. She then became a professional volleyball player, and she actually died on a rotation while playing professional volleyball in Japan. She died of an aortic aneurysm at a very young age, as I recall, in her mid 30s, early 30s. But she has a condition called Marfan syndrome. And if you knew what Marfan syndrome was, you could look at this photo and you should have been suspicious. So a doctor of chiropractic, when they're properly educated, can make this assessment and actually help save a life. I think that's pretty cool. When we look at cardiovascular pathology, I'm not actually even talking about spines, muscles, and things like that. I'm talking about our role as as a chiropractic physician in the evaluation of cardiac pathology in the athlete. So there's screening questionnaires because the history is really important. Almost 80% of cardiac pathology can be identified through a proper history. There's a pre-participation examination where we auscultate the heart, we palpate pulses, we check blood pressures and the likes of that. And sometimes we do EKGs to look at the heart, but nevertheless, targeting that heart's a big deal. And we make sure that we have the proper skill sets so that we're capable and extremely competent. This particular slide is a slide that talks about mortality in sport. And so this is specific to the heart. And you can see that HCM, hypertrophic cardiomyopathy, is the most common cardiac killer of an athlete. Hypertrophic cardiomyopathy is when the heart enlarges and the interventricular septum between the left and right ventricle and the anterior wall of the left ventricle become thickened. And once they measure over 1.8 centimeters, that's an indicator of hypertrophic cardiomyopathy, which then can lead to arrhythmias, and that's not a good thing. Commotio cordis at 20%, that's what happens when something strikes the person's chest wall at just the wrong time. It could be a ball, softball, baseball. It could be the tip of a football. It could be a fist. It could be whatever it is. But what happens is if it hits at the exact wrong millisecond, it stops the heart from repolarizing. By the way, you save those people with an AED. So when we classify sport, you're probably thinking, well, sure, there's collision sports like rugby or ice hockey, where a big part of the sport is actually to have bodily contact. That's a collision sport. A contact sport's a sport where people have contact, but it's not the essence of the sport. I like to use basketball for that example. So athletes come in, they set a pick, and so you do have the within the rules bodily contact, but the point of the sport's put the ball through the hoop. Then you have non-contact sports. Tennis might be an example of that. Um, Interestingly enough, some people classify cross country as non-contact. That's the first sport I took care of. And I'll tell you on the backside of the course, there's a lot of contact going on. Another way to classify sport is through static and dynamic cardiac demand. And so one has to do with pulse rate, the other one has to do with pulse, like pressure. And so these are things that we learn about and we talk about. I think it's interesting. The PPE is a pre-participation exam or the sports physical. The most common problems that we see in the athletes that we do, and I've done thousands of these, is hypertension. It's kind of interesting. Young people presenting with high blood pressure readings, and they could be junior high schoolers. So that's a huge problem. And we need to be able to coach those athletes into making sure that they're safe to participate in sport, as well as manage to their blood pressure through participation in sport. It's kind of interesting. Vision changes. We don't do genital exams, and we do screening examinations. So when I think about my amazing life that I've had in chiropractic, it really was the last piece of the puzzle. I started out in fish and wildlife biology because I just love to be outdoors and I really like the sciences. Then I found out that in the United States at that time, only 1 in 160 actually can get a job of graduates. And I thought, well, I guess I'm not going to go FWB. And then I thought, what are my best fields? Well, I happen to really like chemistry. It's always been easy for me. I enjoy chemistry. And so then I was actually in pharmacy school and I thought, hey, the pharmacist doesn't actually get to pull all the triggers because I want to be able to lead it. And so my father was a chiropractor, and essentially I want to do anything but what he did. And then I thought, well, that's not a very good reason. And so that was the last piece of my puzzle because I think life is supposed to be a great adventure. It shouldn't just be going through life. We should actually be living life. And so to live life, you have to know a lot about yourself, right? You have to know what you're willing to do, what you're not willing to do, where that line is you're just not going to cross, so that you can protect your morals, protect your values, and protect yourself as a person. And so that's something anybody could do, regardless of what you decide to do in your future. However, you also need to take some what I call safe risks. Those are risks that don't risk your family, your finances, your morals, all these things, but yet they make you a little uncomfortable. Perhaps for you, it might be trying to become a doctor of chiropractic. You don't know until you try. And putting yourself out there to try and live an adventure, that's what it's really all about. And that's what makes life fun. I'll guarantee you, I would have never made it to an Olympic Games if I was unwilling to be a little uncomfortable, and I've been to five. And so think about your puzzle of what it is that you want to do. And I realize it's so hard to know sometimes because you're just not sure. Well, sometimes you have to have a little leap of faith and do the right thing. So when you look ahead to whatever it is that you want to do, maybe I could share with you a little bit from somebody that's been in the field for 40 years. By the way, I've been doing what I do for 40 years and I'm far from burned out. I want more. I want to be able to do more. And the reason is when you become a chiropractic physician, you can learn about whatever you want to learn about for the rest of your life. It's a never ending cycle. But instead of having somebody tell you you're going to take this class and this class and this class, when you get your license, if you're into nutrition, you can study that. If you're into sports performance, you can study that. If you're into sports medicine, you can study that. If you're into radiology, you can study that. And that's what's really cool is you can start to develop this niche of expertise in whatever thing that turns you on and you really enjoy. So as you look ahead, life is supposed to be an adventure. And when you go through life, I would really encourage you to try a couple things that maybe make you uncomfortable, things like public speaking, things like volunteering for whatever it might be. But become a part of the community that you live in and be a contributor to society as a whole. That social psychological connection is the thing that will keep you fresh. So as you're flying along on your lifelong adventure, think about where it is you want to be and think about where it is you want to go. So in this particular slide, it shows a person holding a compass and they're looking at a mountain. Well, if you want to summit that mountain, you don't just go to the top of the mountain. The first thing is you have to cross that snowfield in front of you. Then you have to get through the trees. Then you have to get to that first ledge. Then you have to move on and on. And so what I'm saying is to have an amazing adventure in life, you have to have an idea of where it is you want to end up. And then you have to understand the different steps that are required so that you can actually get to that summit of your own mountain. Earlier, I talked about drawing the line in the sand, and you should work on drawing the line in the sand before you approach the line. You should have an idea of what it is that defines you as a person and what it is you will do and what it is you won't do. And if you think about those kind of things when you're calm, when you're approached with the situation, rely upon your calm self to make sure that you do the right thing, but don't cross the line in the sand. The slide on the right talks about risk. When you watch the gymnasts and they're working on the beam, to me, the beam looks like it's like that wide, but actually it's the width of my hand. It's about 4 inches. And so when the athlete leaves the beam, as this picture is showing, the hands aren't in touching the beam anymore. That's risk. But in addition to that, through practice, it diminishes the risk. And so you think about how are you going to blend what it is that you want to do as a person, as well as what is acceptable risk. This slide talks about competition to me. When I see this slide, I love to watch a well-run track and field event. These are 100-meter sprinters, and this is an Olympic 100-meter race. So in other words, these people are uber fast human beings, right? But when I look at them, they are competing with each other. However, I don't compete with another doctor of any kind. I don't compete with physical therapy. I just compete with myself. So when I look at this slide, I see 10 versions of me. One of them's from yesterday. And today, my obligation is to be a better person, better husband, better dad, better doctor. And all the competitors that I'm competing with are yesterday's version of me. I really like that idea. I think that we have an obligation to become a better person every day in some form or way. Because in life, sometimes you're going to hit a hurdle. And many times you'll cross the hurdle, and sometimes you won't. And so it's really not so much that the hurdle stopped you, it's what do you do with that? And so, for instance, as a doctor, sometimes you're going to miss a diagnosis and you're probably going to feel pretty bad about it. But rather than just wallow in feeling bad, you should do something about it. You should learn, how did this happen and how do I not have it happen again? So I think that everybody teaches us something, each patient that we interact with. And sometimes the patients as a doctor that you like the least are the ones that teach you the most. In other words, it's easy to like somebody who's healthy and physically fit and attractive and interesting and a great conversationalist. It might be a little harder to enjoy that patient who is the opposite of all of those things. But in actuality, it's the one that's the opposite that may need you the most. So when you hit hurdles in life, not only get through the hurdle, you know, the old saying, if you're in rough water, best way to get out of it, keep paddling, but also then reflect back about how did that happen and how do I not have that happen again? So these are some of the challenges that I had. This is a picture of my house in Colorado Springs, Colorado. Um, Probably about 8 years ago, there was a huge forest fire that went through there, and my kind of forever house burned to the ground. And so that's me in my Jeep watching the house burn. And on the lower right, that's what the house looked like. It absolutely turned that house into ash. And to be honest with you, it was a bummer for a couple days. But after that, my family, they were safe. My dog, super dog actually, Lucy the Wonder Dog, she was safe. And so everything else is just materialistic stuff. And believe me, we make more stuff every day. So get good insurance and buy some more. But nevertheless, the lesson that I learned from that forest fire was that I had done a pretty good job of not letting possessions define me as a person. It's really about the people and about my own memories. So I hope that you enjoyed this little talk, and I'll stop the share. I see we have something in the chat. Are you going to help me with the chat management?
Most definitely. And I was just going to say, I'm sure that everyone attending has lots of questions. So feel free to post them in the Q&A, and you can toggle to choose whether or not you want to post it with your name or anonymously. So don't be shy. It looks like the first question that we have is, are we as future chiros able to make diagnoses such as hypertension if we come across an athlete with high blood pressure, for example?
Absolutely. Not only is hypertension the most common abnormal thing you will find on a pre-participation examination, not every person who has hypertension has to undergo uh, medical care of pharmaceuticals. So recently, you know that the scale for the definition of hypertension was dropped about 10 degrees. And so oftentimes the person may be pre-hypertensive or have stage 1 hypertension, where you absolutely you can make that diagnosis, and in fact you should. But in addition to that, you should help your patient through looking at lifestyle changes to see if you can help them lower their blood pressure, whether through diet, hydration, decreasing cardio stimulants, those types of things. And so for sure, we do it every day. We check a lot of blood pressures. We also check pulse oximetry. We do different types of things like that on a pretty routine basis. My special area of interest is sports related concussion, and I work with a lot of concussion people. And so, absolutely, hypertension right within our swim lane.
Excellent. Another question just came in. How does sport chiropractic or the additional sports medicine degree translate to Canada? Does the role
Ah,
of a sport chiro differ from when coming back to Canada?
it is a little bit different. And so, if you're a Canadian and you want to have a sports medicine practice, the track that you would want to take is through the Sports Masters program. There's the Royal Academy of Sports Chiropractic in Canada, and the master's program is recognized as qualifying that individual to sit for that specialty piece in Canada. In addition to that, there's an organization called FIX, the Federation of International Chiropractic Sportative, and they also have more of an international flavor of a certified chiropractic sports physician certificate of additional qualification. So my particular cohort of interns has several Canadian interns who work with me, and we talk about sports every day. So that's how that works, and you can be fearless in approaching that nuance to how you want to practice. Glad I
Okay.
mentioned curling.
While we're waiting for a couple more questions to come in, I do have a couple for you as well, Dr. Moreau. I'm curious, what's been the most interesting case that you've seen in the clinic recently?
um, I would say a couple different things that are pretty interesting. One of them is post-concussion syndrome with a disorder called postural orthostatic tachycardia syndrome, or POTS. Our nervous system, you have the parasympathetic nervous system, the calming side, and the autonomic nervous system, which is your fight or flight side. And so people that have head injuries that don't actually get the right kind of care and their head injury lags on, sometimes they develop autonomic nervous system dysfunction where their heart rate will run off or their blood pressure will drop. They'll be doing the strangest things and they'll just pass out. It could be in a grocery store, could be just walking across the front yard. And so right now we're using kind of a modification of what's called the Buffalo Protocol to be able to help those people retrain their autonomic nervous system. They do get adjusted, but how we do that has to do with producing static loads to the heart using controlled weightlifting while they wear a heart monitor. Sometimes we spin them on a bike and sometimes we use a treadmill to provide positive feedback to their autonomic nervous system to help them correct these long-standing problems. See, that kind of excites me. That turns me on. I'm really interested in helping people return back to life. So that's one. And I do quite a bit of research. I've been published, I have 60 scientific works. And another thing that I'm doing is the utilization of what's called auriculotherapy. Now, like this is as far out as I get, but I'm using a class 4 medical laser. That's the real deal where you have to wear your glasses and those kind of things like that. And I have a cohort that we're treating for tinnitus using the laser. We actually hit acupuncture points with the laser, and almost all of those patients are improving. And some of them have had durations of tinnitus or ringing in the ears of 8 years. I think that's pretty interesting. So at a university, we have an IRB. And so we do the types of things you would expect. We fix people with low back, with disc and things like that. But we're also doing things that you might not expect. And we're trying to be solution oriented for those types of people that have fell through the cracks.
Wow, thank you. We have a few more questions if you're open to it.
Sure.
Uh, the first one is, does UWS Sports Med specialty have the ability to do research with faculty or on their own?
Yes, I think that I just kind of wandered into that one. And so we have an IRB board, internal review board. And so you write your IRB for your research project. And as I'm sure the questioner probably has some experience or interest in this area, when you have human subjects, you have to undergo some scrutiny. A lot of the things that we do are retrospective case studies so that the study itself doesn't influence the patient's care once they've discontinued, they're finished with their care. But absolutely, I'm the faculty person for most of the sports medicine stuff. Certainly don't have to be all of them, but there's all kinds of interested people. I think we have over 20 studies ongoing right now, including some of the ones that I talked about, because contributing to the literature of health, that helps everybody. And I think that it isn't necessarily for everybody, but for those people who are interested in it, it's the way to go. One of my interns recently published in Nature. That's a pretty big journal. So, yeah.
That's great. The next question, I'm an athlete and I know that I want to work in the sports medicine field and I'm trying to choose between chiropractic school or physical therapy. What pros would you say make chiropractic school the best choice?
Well, first of all, I'd like to just say to you, you can't lose because those are two really good fields. A lot of my friends are physical therapists, and I just want you to know that you're in the groove. What are some of the differences? Well, they both now pretty much retain the title doctor. That's true, but doctor of chiropractic has the ability to render a diagnosis and be able to really treat independently. In some states and in some provinces, the physical therapist also has open access, but not all of them. And so I think that a lot of the physical therapy work is a rehabilitation of post-surgical patients. That's not my particular interest. Mine's kind of on the other side of helping athletes be able to achieve their best sports performance opportunities, more about kind of looking for that fine difference. And so I think both fields are great. Both fields are in the same family, a brother and a sister or whatever. And so I just like having the ability, as I mentioned earlier in my personal story, having the ability to direct what it is that we're doing. I want to be able to, I want to be the captain on the ship. And it's not to say that the physical therapist cannot be, but typically I think that that's kind of how it rolls. And I just like to be in the lead.
Thank you. The last question that I see here is, if I want to be a sport chiro and work with a team or high school athletes, what steps should I take to accomplish this, both in the US and in Canada?
Absolutely. It's the same steps. Uh, Going across the border doesn't make any difference. Number one is, that's what I did. And that's how I built my practice to be a pretty large practice. I was in a very small community, like throughout the United States and Canada. There was only 8,000 people in it, but I had over 15,000 active patients. And so, how do you do that? Well, number one is you always kind of keep an eye on the sports medicine thought process as you go through your curriculum and as we call it, matriculate through. And then, just like any craftsman, you have to hone your tool set. Some kind of a master carpenter doesn't just take the same tool, they take care of their tools. So you have to take care of your knowledge. You'll have to learn about how do you manage soft tissue injury, because that's very common. How do you manage sports related concussion? How do you do all these things that you see a lot in sport? And then what you do, especially the first opening rounds, is you have to become involved in sport. And when one of the things that I did that worked very well for me, and my first sport was cross country. Why did I start with cross country? Because they asked me to. In the United States, cross country doesn't have cheerleaders, it doesn't have a band. The people that are there are either the athletes, they're a coach, or they're a family member. And strangely enough, I wasn't a cross country runner. And so I had a lot to learn, but I was there to serve. And so when you work athletic events, you should work that athletic event to serve the athlete, to protect their health, to make good return to play decisions. And if you shouldn't actually be there to try and garner referrals for your practice, because I'm telling you, those will come. But be there for the right reason, learn what it is you need to learn in order to be useful to that team, and then know what you know and know what you don't know. And so if you're working up an athlete and you're not sure what it is, you should probably move that athlete on. And if it's at a bigger setting, like a university setting, look at who's around you on the sports medicine team. That's how I led sports medicine at the United States Olympic Committee. Is I had orthopedic surgeons reporting to me, cardiologists, all different kinds of people. But they didn't have a problem with it, because what I was doing is directing traffic. And so remember, you don't have to fix everything that presents to you. Sometimes just being a great collaborator is almost worth more to the patient that you serve. But I liked your question. I hope I answered it to your satisfaction.
Thank you so much, Dr. Moreau. It
My
looks like
pleasure.
that was our last question. So thank you. And thank you everyone for attending. Those are excellent questions. Hopefully we answered all of them. But if you do think of others, feel free to reach out to the Office of Admissions at admissions@uws.edu or at 1-800-641-5641. And we can forward your question on to Dr. Moreau if it's related to him, or if it's about the university in general, we'll be happy to answer it for you.
I do have one more thing I
Oh,
would like to say, Miss French.
sure.
There's a lot of places you can go to learn how to adjust people. But if you want to become a chiropractic physician and be able to be knowledgeable, to articulate some of the things that we talked about today, University of Western States is the place to be. And I want to invite you to come and join me as we create Chiropractic Physician 2.0. You can be part of that. I really hope that whatever pathway you choose through life, it brings you joy and it brings you happiness. But I would also like to share with you, I think that in the field of chiropractic, that this is a place to come to. Back to you, Miss French.
Thank you so much, Dr. Moreau. Those are really good points. We hope that whatever route you choose for your future career, that you at least make a stop at UWS on the way. And if you have any other questions, feel free to reach out. But otherwise, we hope to see you on our campus one day soon. Thank you, everyone, for attending.
I know.
Bye.